Welcome to Monday's edition of COVID-19. I'm Min San-hee. The global tally of infections has now surged past 20 million. Indeed, in just a span of 43 days, the world has recorded 10 million more cases. But in countries like Lebanon, the pandemic is not the only plight. People there are reeling from a tragic blast that has killed, hurt and displaced thousands. And speaking of thousands, those are the numbers of people affected by the torrential downpour here in Korea. We start the program now with the latest numbers on the pandemic with our Kwon So-ah and related news with our Yoon Jung-min. So, how are we starting the work week here in Korea?
Well, Sunny, the situation is looking better than on the weekend because new COVID-19 cases dropped to the 20s this Monday.
Right. Speaking of the weekend, so we saw quite a number of cases, domestic cases that is, this Saturday and Sunday.
Right. In fact, we had 30 on both Saturday and Sunday, and with the majority of them having occurred in the metropolitan region. Now, this Monday, we have 17 local cases, so around half of what we saw on the weekend, with some 11 imported cases, which means today's caseload stands at 28, and the death toll remains at 305, while we have a dozen more people in quarantine and 16 new recoveries, raising the total there to 13,658, that is. Now let's move over to our graph. As we can see here, since Saturday, we are seeing a downward trend after we hit the 40s. But if you compare this Monday to last Monday, the number does not seem that different. But this was when we had only 3 local infections, which was a 3-month low we had this past Monday. So the concern now is that we have more cases spreading domestically, and we can see that if we take a look at our map now. We have Gyeonggi province in Seoul with 6 and 13 cases respectively, and 17 here were infections domestically, and 1 local case was also reported in the city of Busan. And many of those cases here in the metropolitan region were linked to religious services, including an outbreak at a popular market in the capital Seoul, which the first patient was found to be a churchgoer in Gyeonggi province, meaning we still have these chain transmissions continuing. Meanwhile, out of 11 imported cases, we had 6 that were detected at the nation's airport or seaports.
Right. So speaking of imported cases, the virus globally is spreading fiercely. We have 20 million cases now.
Right. We are seeing many new milestones hit in the past few days. And let's take a look at the figures as of noon Korea time. As you said, Sunny, 20 million plus some 24,000 new cases in total, as we have almost 220,000 new cases reported in the past day, and also almost 734,000 fatalities with almost 12.9 million recoveries. And as I was mentioning milestones, the U.S. now has over 5 million cases, almost 5.2 million, with almost 50,000 new cases reported in the past day. Brazil has hit 3 million cases and also over 100,000 fatalities. And we're seeing India with 2.2 million cases, and India now has the fastest rise in cases with some 62,000 reported in the past day. And no containment seen in Latin America, especially in Mexico and other countries like Peru and Colombia, Chile. Colombia, meanwhile, has surpassed Chile with some 387,000 cases, as this country is reporting some 10,000 cases on a daily basis. So this battle against the coronavirus is going to be a prolonged one before we have a vaccine coming out. And that's what our Yoon Jung-min is going to talk about next. And I'll be back after the government briefing.
All right, so thank you for that. I'll see you back at the desk. Right, as Soa said, amid the global race for a vaccine, questions persist with regard to equal access and availability. I have Yoon Jung-min here in the studio with some of the answers to these inquiries. Welcome, Jung-min.
Hello, Sunny.
Jung-min, let's begin with the possible price of a vaccine. How much are we looking at?
That's right. So it would differ by companies. Well, Moderna said last week that it's going to charge between $32 to $37 per dose for its COVID-19 vaccine. But the company also said it may offer lower prices for a larger volume, though. The Moderna said that they are working with governments all around the world to ensure a vaccine that is accessible, regardless of one's ability to afford one. Another drug maker, Pfizer, and its German partner, BioNTech, earlier signed a deal with the U.S. government, and its price was settled at a little over $19 per dose. So that's a bit cheaper than what Moderna has pitched. In total, the deal was worth almost $2 billion US. Take a look.
They were priced at $19.50, which for a two-dose vaccine will be around a little bit less than $40, less than what you would pay for many of the flu vaccines.
But Pfizer also said that other developed countries will not be getting the vaccine at a lower price than what it charges the U.S. Another drug maker, AstraZeneca, said it will not profit from a COVID-19 vaccine during the pandemic. The company reached a licensing agreement with Serum Institute of India to supply vaccines for low and middle income countries. Last month, AstraZeneca signed an agreement with South Korea's SK Biopharmaceuticals to manufacture and export vaccines to other global markets.
Right, Changmin. What about demand? I hear many countries have already placed orders in advance for these vaccines.
That's right, Sunny. So demand for the vaccine is rising globally. Well, Bloomberg reported that the U.S. and U.K. are in the process of securing supplies from French drug maker Sanofi and others, while Japan has been in contact with Pfizer. The EU has been aggressive in obtaining doses as well. According to London-based analytics firm Airfinity, the U.S., Britain, EU, and Japan have so far secured some 1.3 billion doses of potential COVID-19 immunizations. They are all countries that have been hit hardest by the pandemic, but Airfinity forecasts it will take around 2 years to manufacture 1 billion doses. With wealthy countries already securing 1 billion vaccines, many observers are worried that the rest of the world could be left behind. They say supply will likely struggle to meet demand for some 7.8 billion people in the world. Earlier this month, South Korean health official Kwon Jun-wook called for international solidarity to curb a possible monopoly. Amid this global health crisis, Kwon said COVID-19 vaccines should be regarded as a public good. Take a look.
We asked the World Health Organization to take action and intervene in the matter. Amid this once-in-a-century health crisis, we must unite and work together to tackle the pandemic. Also, in the spirit of humanity, vaccines and drugs should be treated as public goods.
Last week, the WHO chief also emphasized the need for equal access to a vaccine, saying the world must recover from the pandemic as one. The Director General added that faster economic recovery would be possible if the world shares vaccines.
Indeed, Changmin, sharing is caring. How is Korea working with its global counterparts to ensure equal access to vaccines?
That's right. So South Korea has joined an international COVID-19 vaccine alliance known as COVAX, and they will be working together with them for broader access to immunizations. Along with the Coalition for Epidemic Preparedness, Innovations and Vaccine Alliance, Gov'T, the WHO has formed COVAX to ensure equitable global access to COVID-19 vaccines. They have earlier announced a plan to secure 2 billion doses by the end of 2021. Korea is expected to secure enough vaccines to immunize up to 20% of its population. So far, some 78 countries have reportedly expressed interest in joining COVAX. Take a listen.
So any country that supports COVAX has a better chance of getting a successful vaccine candidate than going after a single one on their own. More the countries that join this facility and contribute to this risk pooling mechanism, the greater the chances of success.
AstraZeneca became the first manufacturer to sign up to Gavi's program in June, committing 300 million doses. Bloomberg said Pfizer and BioNTech signal interest in potentially supplying COVAX.
Right, Changmin, do you have any updates on the clinical trials that are underway for vaccine candidates?
I have, Sunny. So most vaccine developers are now in their phase 3 trials. Those include Moderna, AstraZeneca, and Pfizer. Moderna has already started phase 3 trial on some 30,000 participants, and the results are expected as early as October. Other frontrunners, AstraZeneca and Pfizer, are also on the last leg of their clinical trials. So we can expect vaccines at an earlier date, but there are some hurdles to overcome. The vaccines must demonstrate their effectiveness, gain regulatory approval, and be ready for mass production. As for COVID-19 treatments, the antiviral drug remdesivir has received emergency authorization from the FDA to treat seriously ill patients, but it has not been formally approved yet. Korea's GC Pharma and Celltrion are conducting clinical trials for their plasma treatment methods.
All right, Jung-min, thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular afternoon briefing on COVID-19. Concerns over church-related cases have been reignited amid reports of infections at churches in Goyang, north of Seoul, and one church here in the capital city. Local transmissions dropped to as low as 3 last Monday, but sporadic cluster infections linked to places of worship have, in recent days, pushed domestic infections up again. Here is the briefing. We'll come back to you afterwards.
First, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of August 10th, we have a total of 17 new local infections and 11 new imported cases. The total number of confirmed cases now stands at 14,626. 16 more people have been discharged following full recovery, while 663 people are in quarantine. There are 16 patients with severe or critical conditions. There were no additional fatality. And let us first look at the updates on domestic cases. In the Banseok Church in Goyang City, we have 7 new cases, and they were confirmed during the epidemiological investigation, and a total of 31 cases have been confirmed to date. And of them, also include the vendors, also 7 vendors who are working at the Namdaemun traditional market. And also in relation to the Rejoice Church in Goyang City, we have 1 additional case, and so far we have 21 cases being confirmed to date. And we also had 2 cases that have been not categorized, and we have found out that they were related to a Lord Church in the Gimpo City, and a total of 6 people have been confirmed, and a total of 8 people have been confirmed, and we are conducting epidemiological investigations to date. And here are some updates on our imported cases today. As of today midnight, we have 11 new imported cases, 6 of which have been confirmed at points of entry, while the other 5 have been spotted while on self-quarantine. 5 were South Koreans and 6 were foreigners. And as for countries, 3 were from USA, 2 from Philippines, and 2 from Bangladesh. And looking at the cases, a COVID-19 control situation and risk factors for the past 2 weeks, we have confirmed that average daily new imported cases has decreased from 31.4 to 21.4, and the average daily new local infections has decreased from 19.9 to 12.1. And looking at the sources of infection for the past 2 weeks, 300 or about 63.8% were imported cases, and 81 cases, about 12% were domestic cases. And 40 of them are under investigation, and the chains of transmission through the imported cases were 7 cases. And as for the imported cases on a daily basis, we had about 20.4 cases, and this is about 10 cases lower than the previous 2 weeks. And in order to intensify our quarantine measures, we have made 6 countries subject to tougher quarantine measures, requesting all of them to submit a PCR negative document and mandating all of the foreign entrants to have 2 times of the diagnostic testings before they are dismissed. And however, considering the surge in the number of cases on a global level, we need to proactively react towards the COVID-19 cases, and we have been intensifying our quarantine measures for our ports, and also we will be intensifying our infectious disease prevention and control measures. And also we have witnessed and we aimed to prevent the family transmissions from those who are on self-quarantine. So we are mandating all of them to go out, to refrain from going out to their places of self-isolation, and also refrain from having direct contact or physical contact with their family members, and always wear face masks while on self-quarantine. And during the past 2 weeks, we have about 12.1 domestic cases on an average basis, and this is down by 7.8. And we have seen a decrease in the number of patients in the age group of 60. However, we have seen a surge in those who are aged between 40 to 50. And as for a majority of the cluster infections in the metropolitan area, we are seeing cluster infections at religious centers, cafes, and restaurants, as well as door-to-door facilities. And therefore, we are mandating all of the public to abide by quarantine measures. If you are having physical services and at religious services, we ask you to refrain from eating together, and also refrain from having small group meetings prior or after having the regular services. And also we ask you to postpone and cancel all of the summer retreats as well as other events. And as for the door-to-door sales, we have seen a continued cluster infections, and they range from small promotional meetings, and they have been clustered together at certain periods of time at closed spaces, and we note that there is a high risk of infection at these facilities. And we ask those who are aged over the middle-aged and those of the senior citizens to refrain from going to these places. And during the upcoming summer holidays, we are intensifying our on-site inspection for these destinations, and we ask you to continue to refrain from going to crowded, closed, and close contact environment, including clubs, bars, cafes, restaurants, as well as other multi-use facilities going forward. And we also ask you to refrain from having group accommodations over retreats as well. And during the past week, we had 4 fatalities in South Korea by age group. We had 2 people in the age of 90s and 1 in 80s and 70s respectively. And as for the fatality rate, those for the 70s stood at 9.2%. And we are also looking at the virus genetic species from the 766 patients here in South Korea. And as for the patients, we have about 500 of them who are the domestic cases, and about the rest of the 200 from the imported cases. And in the until early April, we have seen S group that has been sporadically increasing, and this has been changing. And in Africa and so forth, we are seeing GR, and in the North American continents, we are seeing a GH. And as for domestic cases, before the April, we have S and V group, a majority of them. However, after that, in Yecheon province, also in the Itaewon Club case, we are seeing GH virus, which are being detected here in South Korea. And as for the imported cases by countries, we have differing virus groups. However, we have the majority of them being GR group. And as for the imported cases, we are seeing the spike protein, which is related to the infections and transmission. And we have seen new variations of these protein. And we are also requesting further analysis to the WHO. As of now, we are seeing that there is no effect on the PCR testings. However, we see that there is a need to conduct further analysis going forward. And we have seen a heavy torrential downpour, and we aimed to intensify our quarantine measures for COVID-19 at temporary shelter places, and we continue to ask the members of the public to abide by hygiene measures, especially to avoid the waterborne and foodborne diseases. We ask you to always wear face masks and keep your 2-meter distance and wash your hands at temporary shelters. And also we have a food poisoning as well as diarrhea, so we ask you to consume safe water which has been boiled, and also we ask you to eat food that has been fully cooked, and also take particular precautions as you could be prone to the eye diseases as well as skin irritations and EHEC as well. And after working at the flooded areas, we ask you to always wear long sleeves and long gloves as well as long boots. And after your work, please wash your hands thoroughly with running water and soap. And if you have symptoms of a fever, please go to the doctors. Thank you very much.
Right, that was Chung Eun-kyung, the head of KCDC, with Monday's afternoon briefing. So do give us a gist of the key announcements.
Okay, because it is Monday, Chung Eun-kyung, the KCDC chief, had the analysis of the past 2 weeks when it comes to daily cases, for instance. Imported cases went down from 31.4 cases the previous 2 weeks to 21.4 cases in the last 2 weeks, which means 10 down. And also local infections went down from 19.9 on average to 12.1 on average, so almost 8 patients less on a daily basis. And we had some 60% imported cases in the past 2 weeks as well. And if we take a closer look at today's new infections, I mentioned earlier the case in a market in Seoul. We're talking about the Namdaemun market. 7 people have been added to that list of people who were infected there. And those are also linked to a church in Goyang's Gyeonggi-do province, where there also have been 7 new cases, with a total now being 31 cases. And also Chung mentioned that people going to religious services and also at door-to-door sales businesses should abide by social distancing measures, especially when it comes to wearing masks.
All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Environmental concerns appear to have taken a backseat to those of health amid the pandemic, giving way to a surge in the waste of disposable items. But there is one city here that is seeking to keep the government's temporarily halted waste management campaign back on track. Do take a look.
The COVID-19 pandemic has led to a surging amount of waste, with more people turning to disposable products as a way to avoid infection.
아무래도 배달 음식이 좀 많이 나오다 보니까 플라스틱 양이 좀 많이 늘었어요.
요새 코로나랑 그 여러 가지 감염 때문에 일회용 용품이 좋지 않다고 생각은 하지만 많이 쓰게 되는 것 같아요.
Disposable products are usually made of materials such as plastic and aluminum that take at least 5 centuries to decompose. While the pandemic has made it necessary for us to use more disposable products, how can we ensure that we're recycling more as well? The most important aspect of recycling is the proper sorting of our waste. At this recycling center, you can exchange recyclable items like paper, plastic, and glass bottles for rewards, but only if they've been cleaned and dried. It's a great way to learn about the proper sorting of waste.
잘 모르겠으면 아더고요. 그냥 아무데나 막 넣으면 안 되고.
There are many different types of plastic, so you must check the labels on your plastic waste and sort them into subcategories like PE and others. Different items can be traded in for different rewards, such as rolls of toilet paper for milk cartons and waste disposal bags for used batteries. There's even an app where you can check your recycling history.
막상 해보니까 제가 만드는 쓰레기가 너무 많아서 반성을 더 많이 하게 되는 시간이 더 많이 생기는 것 같아요.
우유팩은 휴지로 바꿀 수 있어서 좋고 플라스틱이나 다른 재활용되는 것은 지역 화폐로 받을 수 있어서 좋은 것 같습니다.
The city of Seongnam had in fact launched its Resource Circulation City project well before the COVID-19 outbreak.
어떻게 보면은 분리를 잘하는 것보다 깨끗하게 버린다가 재활용의 영역에서는 되게 핵심인데 그러한 교육들이 제대로 되지 않았다. 그래서 이제 시민 참여를 통해서 이러한 인식 개선을 하기 위해서 자원순환 가게를 운영하게 되었습니다. 성남시 선별장의 재활용률은 70% 가까이 도달하고 있습니다.
So what is the correct way to recycle? With vinyl products, plastic bottles, and glass items, they can only be recycled if the items are clean and contaminant-free. That's why, even though it's made of paper, instant noodle cups are unrecyclable because it's been soaked in grease. For plastic and glass bottles, make sure to remove all labels and bottle caps to make sure they can be recycled. Even waste can be turned into a precious resource, but only if you clean and sort them properly.
Also around the world, protests filled the streets of Beirut this past weekend following a massive blast last Tuesday centered at Beirut's main port that killed 158 people, wounded some 6,000 and displaced about 300,000. For more on this, I have Hadi, that is, Nasrallah, who witnessed the explosion live on the line. Hello, Hadi.
Hello, how are you?
Fine, thank you, Hadi. Now, I understand you witnessed the tragedy firsthand. Please tell us about what you saw that day.
Basically, I was coming from an area in North Beirut, going back to my home in South Beirut. We passed next to a fire. I saw the fire, and people said that initially they heard an explosion at first. It was a smaller explosion than the one that people witnessed. I didn't hear the first one, so when we passed it and we went through the buildings, suddenly I lost my hearing, I lost my sight for seconds, and the explosion just erupted. All the car was destroyed, the glass, all the buildings. I felt like the buildings are falling on us. All the glass was falling all over the city. It was an apocalyptic scene, something I would never forget in my entire life.
Hadi, that must have been a very frightening experience. Now, there also appears to be much controversy over the cause of the blast, with some claiming that it was negligence and others asserting that it was a bomb. What is the government's stance with regard to the cause?
The government has not issued an official statement as they're waiting for investigations for now, but the government is divided between having international observation or internationally led investigation or a national investigation by the Lebanese military and the Lebanese army. So until they decide that and what's going to happen, we would not know for sure. But as for now, we know that there were explosives kept in that place. They were taken from 6 years before. They were kept inside the port we didn't know about. But how did they manage to explode? That we don't know yet. There's a lot of conspiracy theory going on around it. If it's an attack, if it's intentional, if there was a bomb inside. Other stories are saying it's an accident. There's a fire. There's been fireworks next to it. They suddenly erupted, which led to the explosion at the end. But until now, we don't know for sure what happened.
I see. Hadi, public protests have been rampant there. What is fueling these protests?
So basically, the protests have been happening since last October 2019. We went down the streets to against corruption, against the government that has been leading this country for 30 years, the same ruling elite that have been devastating this country financially, economically, even security-wise. So until coronavirus broke out in the country, people just start going home back. But now after the explosion, people have had enough. They went down the street because they're blaming the government for this. So no matter what happened, if it's an attack, if it's intentional, if it's accidental, we're still going to blame the government because they are the ones who kept a massive amount of explosive next to civilian areas inside our vital port and most essential port. Now is all evaporated because of the government negligence of security concerns.
Hadi, now to make matters worse, the world is fighting a pandemic as we speak, and I assume Lebanon is also doing its part to contain the virus. Do tell us a bit about the COVID-19 situation there.
So our situation was before, talking weeks back, it was, let's call it semi-stable. We didn't have that much cases, but because of the economic collapse in Lebanon, and Lebanon is mainly dependent on tourism, our government had to open the airport and the tourism sites. So since then, it's been a disaster. Just last week, in one day, they discovered more than 300 cases. Lebanon is a very tiny country. We're only around 5 million people. In one day, they discovered 300 cases, even more. So we presume it's going to be much, much more the next coming weeks. And after those protests, which we cannot stop after what happened, I expect we're going to witness a disaster with the coming weeks when it comes to numbers of coronavirus. And hospitals, of course, now are overwhelmed because of the injured and the victims of the explosion.
Lebanon currently has at least 6,500 infections, right, Hadi?
Yes.
Okay, meanwhile, the international community is seeking to lend a helping hand given the tragedy last week. Now, Korea, for its part, has provided relief supplies and a $1 million aid to Beirut. What is most urgently needed in Lebanon right now, Hadi?
Now, I mean, Lebanon is suffering from an economic collapse. We've been getting help, but this is not going to be enough. But what Lebanon needs right now mainly is the fact that we lost our most vital source of life, our port, which Lebanon was extremely dependent on because we're basically we just export more than 80% of our needs, more of our food even. So now all the port evaporated. We need international help to rebuild that port as soon as possible. Otherwise, it's going to be a devastation for our people next coming month, maybe weeks. We don't have enough resources to survive until then.
Right, Hadi, our prayers are with you, and do take care, and thank you very much for making the time to join us live at this hour with your thoughts.
Thank you.
가결되었음을 선포합니다.
In light of prospects of a prolonged pandemic, there have been calls for enhanced legislative framework to ensure disease prevention and public order. The Parliament here had already passed a set of bills in February, amending 3 separate acts, including the Infectious Disease Control and Prevention Act, the Quarantine Act, and the Medical Service Act. For more on these laws, I have Professor Song Se-ryang from Kyunghee University. Welcome, Professor Song.
Good to be here.
And I also have Lee Joo-hun, a lawyer from the law firm Yulchon. Hello, Mr. Lee.
See you.
Professor Song, we'll start with you. There have been fresh revisions to these laws related to COVID-19. Perhaps you could start by telling us a bit about these changes.
Right, as you mentioned, there were a slew of laws revised back in April, the February, and it was in fact March, on those 3 laws that either made or strengthened our measures to stop people from infected areas from entering the country, expanded the investigation pool to follow up on the infectious disease informations, and the mask-related laws, and so on and so forth. So at this point, we're making a fine-tuning or making laws that has been to address those issues that have come up. For example, because of the cost related to addressing all those infected people and also masks. So there are some issues that have been raised so far, and I think this government is trying to make a fine-tuning or addressing those concerns of the people.
Right. Now, Mr. Lee, with regard to the latest revision, is that related to the wearing of face masks? Please tell us a bit about the legality of mandating face masks.
According to the revised law, the health and welfare ministers and leaders of the local government are authorized to order the operator and users of places and facilities with high risk of disease infection and passengers of public transportation to observe the quarantine measures, including a mandatory face mask wearing. And the violators can be fined up to 3 million Korean won for the operators. and up to 100,000 Korean won for the users and passengers. In case the violators do not pay the fines can be collected in accordance with the procedure of disposition on tax. If the delinquents run businesses which need administrative bodies' permission, the authorities concerned also have power to cancel or terminate the permission. And an administrative agency can even offer the information concerning the defaulted fines to a credit information concentration institution. In worst case, the delinquents may face a detention up to 30 days.
Those are some very tough laws there.
Yeah, right.
Professor Song, I understand there's also been a shift in the shouldering of medical costs for treating foreign patients of COVID-19. Could you tell us a bit more about that?
Right, of course, those medical bills for the foreigners, if they are not covered under national medical plan, then it's taxpayers' money. So there's certainly a concern. And as you can see from the trend, there are more infected people coming from outside rather than happening in domestic scenes. So that concern has been there. I think I have to make a distinction between the foreigners who are already working and living in Korea, who are already covered by the national medical plan. So probably those will not change. But those people who are coming from outside, I think there is a concern of the taxpayers' burden, but also at the same time, the adverse incentive, so to speak, go to Korea and get a free medical care. So in that sense, there has to be some measures to address those concerns. I think the key issues is about the diplomatic relationship with other countries. There are about 8 other countries that are doing exactly the same thing that Korea does. They treat the foreigners free of charge. So in that sense, probably the reciprocity would be a key guideline. Those countries that do that will reciprocate. And also at the same time, there are people coming from less developed countries that might have financial issues. So from a human rights point of view, probably will address that. But other than that, there has to be some guidelines.
Right. Mr. Lee, what is perhaps the impact of a tougher legal framework on efforts to contain COVID-19?
Well, lots of people, including public health experts around the country, are predicting that more infectious diseases like COVID-19 are expected to come in the future. But just leaving measures to stem the spread of such diseases only under the self-control of each individual is not sufficient. And the golden hour is pretty crucial to block the spread of contagious diseases, and the result can be catastrophic globally as well as domestically if we miss it. In that respect, it's very important to have a ground for preemptive measures in advance by reviewing and enhancing laws for countermeasures with very strong enforcement tools. Of course, there is a possibility that individual rights such as privacy and freedom of residence and movement are infringed on in the process. So we also need to introduce or beef up complementary measures to protect those individual rights at the same time.
Right, because there was quite a bit of concern about the QR code system, right?
Yeah,
The
right.
registration. Professor Song, these amendments related to COVID-19 were swiftly passed by the Parliament.
Right.
Do you suppose that the prompt passage of these rules reflects perhaps the urgency of the situation with regard to COVID-19?
Certainly so, and it's a very welcome sign. I mean, we have seen a deadlock, and there's a general fatigue about these two major parties, United Future Party and Democratic Party, kind of bickering each other on every step of the way. So early on, I think there has been a kind of general failure of the working relationship. But this one, as you mentioned, reflecting the emergency aspect of it, probably, it was a kind of a record time. So it is important that going forward, I think that there might be some situations where we have to act really fast, because COVID-19 is a very swiftly moving, very surreptitiously moving creature that we have to kind of react to very fast in real time. So in that sense, I think we are seeing a welcome sign that those parties can and did work together in a very fast way. So I hope that this becomes a very good precedent for those parties.
Right. Professor Song, in a recent case, a bereaved family here has sued the government for incompetence following the death of one of its loved ones from COVID-19. Could you tell us more about this case?
Right. I kind of share the frustration of those people. They're mostly from Daegu area where there was a major pandemic explosion there. So a couple of civic organizations, including the lawyers associations, are representing those people who lost their families. But at the same time, so their major argument is that government was delinquent or was slow to react to this pandemic situation, even when the Doctors Association has urged a tough measures, for example, locking down the airport to stop people from coming from, for example, China or Wuhan areas. Government didn't do that, so they're saying that government was committing failure in those regard. I'm a little bit pessimistic about the success of those lawsuits. I think that the government probably did as much as possible to do that in this kind of pandemic situation. Is not something that creates absolute duty for the government to follow all the suggestions. So in that sense, probably they have a lot of the burdens to prove in the court, but at the same time, I think, as I mentioned before, this kind of tragic situations is something that should be voiced, and they're exactly doing that.
Right. There was a similar case Mr. Lee made during the MERS outbreak. What was the verdict of that case against the government?
Oh, well, there have been rulings which granted damages to the families of the dead. The bereaved argued that the government had failed to take appropriate measures to prevent the visitors to the hospital from being infected and to notice them of any possible risk of exposure to the virus afterwards. And the courts ruled in favor of the families by judging that the government had not taken proper responses to prevent the contagion and the death. But on the other hand, there also have been cases where the court denied the compensation. The court ruled that it was not clear whether the contraction would have been prevented if the inspection of disease had been implemented at a suitable time. In short, the judgments seem to depend on whether the government performed diagnostic and epidemiological investigation immediately, whether it unveiled the patient's whereabouts and information on hospitals to the public in no time, and whether it set up appropriate risk management plan.
Very briefly speaking, Mr. Lee, what are some of the other legal disputes that have come about because of the pandemic?
Well, I think, I'm not sure, but it depends on the situation. I mean, the patients and then the families who visited the hospital. Yeah.
I see. Professor Song, with regard to legal efforts, are there any being made to perhaps ease the hardships in the employment sector and perhaps the welfare sector?
Right. This COVID-19 has a lot of impacts, but economically, a lot of people are suffering because the business is very slow, and that creates hardships in their household incomes. So in that sense, as we know, back in May, I think, there was a stimulus package of some sort that each family had received. Certainly our family has received that one too, up to about $800, $850 or so it comes out to be. But I think those kind of things are continuing in the municipalities for the low-income families. So in that sense, there's a welfare provisions happening in there. And also, there are the government's effort to reduce the red tapes for especially the small to mid-size companies when they are trying to rehabilitate or come back to the business activities. And in terms of reducing the red tapes, I think there was a law that passed to ease documentary requirements for chemicals produced, but if they're affected by the COVID-19 situation, even if it's not directly related to the vaccine producing.
Right.
So in that sense, I think the government is trying to ease the burden on not only the families, but and specifically small to mid-sized companies.
Right. Mr. Lee, very briefly speaking, within your capacity as a lawyer, of course, speaking within that capacity, are there any other legal efforts that could be made to ensure a better preparedness for the prolonged pandemic?
Oh yeah, it appears that coronavirus have a great impact on economic activities, among others. In particular, it affects the contract relations between people, and the restrictions on activities in both public and private sectors due to the pandemic are giving birth to the interruption or non-fulfillment of the contract in many cases. For a very brief instance, many contracts have a provision for immunity from responsibility in case of non-performance due to natural disasters. And there can be a controversy over whether the spread of virus can fall on the natural disaster. Also, cases are increasing where deaths are overdue as debtors cannot make enough money due to the economic fallout, who ends up with consulting us seeking workouts or bankruptcy proceedings. And in reverse, the creditors' inquiries as to how to collect their claims has also been on the rise.
Right, unfortunately. All right, Mr. Lee, thank you very much for your thoughts. And Professor Song, thank you for being with us today.
Thank you.
Thank you.
Right, well, that brings us to the end of Monday's edition of COVID-19. Tomorrow, we share with you details about the use of remdesivir on critically ill patients here in Korea. In the meantime, do take care and join us tomorrow. Thank you for watching.
It's the first summer since the COVID-19 pandemic began. Water parks, popular hotspots in summer, are opening one by one.